Okay, now we're going to jump into the updates, and I'm going to turn it over to the team.
Thank you, Dave. I'm Lee Wilcox, Deputy City Manager and EOC Director for the month, and on behalf of Kip Harkness and I, I'll be presenting on 3.1 today, along with the entire team. We're going to go through some snapshots of updates from the Emergency Operations Center this last month, as well as an update on our vaccination support efforts on behalf of the county and our residents, and then starting to do a deeper dive into the federal, state, and county public health guidance, which we'll get into and remains somewhat murky. And then Tony Tabor will also be joining the city manager's report on the hybrid meetings referral that we received the other week. Next slide. Globally, the world has seen over 170 million cases of COVID-19 and over 3.7 million deaths globally. More locally, in our own county, 2,153 people have died from COVID-19, and our 7-day rolling average of new cases was 24 per day as of Sunday, with 11 patients in the ICU throughout the county. As we've continued to move, we are currently in the state's yellow tier, which we'll touch upon in a few slides. And on the vaccination front, 76.5% of county residents ages 12 and above have received at least one dose of the vaccination, and 66% of county residents 12 and over have completed their full vaccinations. Our work in the Emergency Operations Center is guided by the council-approved roadmap shown here, which highlights in pink the 18 most important initiatives that are being undertaken in response to the pandemic. As reported out last month, we remained focused on continuing to serve our residents mostly in need from the pandemic as we continue to shift from response to recovery. This is a large and complicated realignment of city service delivery and is almost as complex and as hard as the pandemic response itself. This work includes continuing EOC operations without any interruptions to our most vulnerable residents, returning EOC functions back to departments without interruptions, as well as standing up a large recovery effort in parallel so that we don't lose valuable time. Our approach is one of thoughtful collaboration and thorough as we work with all the departments in the community to guide this work. Next slide. Thank you. Currently, we are in stage 9 of our city framework, and we are in the yellow tier of the state's framework, which is nearing a full reopening. This is the closest that we've been to a full reopening in stage 10 since the beginning of the pandemic. Just for context, we were in stage 5 last December of 2020. And last month we were in stage 8, or the orange tier, as we reported out. As an organization and a community, we continue to work within the guidance of the state's yellow tier framework, as well as the county's latest emergency health order from May 18th. By June 15th, we expect California and San Jose to be able to open. However, I do want to predicate that with we're still not 100% clear on the specifics from our federal and state partners. However, we are headed in the right direction. Sarah Zarate will be going into more specifics of what we know from our partners at the federal and state level and what they've said to us. But I do want to state that navigating the competing policies being put into place now and the implementation of those at a local level will be unclear at times and will require various iterations at all levels of government in the coming weeks and months ahead. Next slide. This provides a snapshot of our work in the Emergency Operations Center during the month of May. Our numerous branches continue to work in support of our most vulnerable. And just quickly want to review that our summer camp programming with PRNS, ages 3 to 5 is at 61% capacity already. Ages 5 to 12 is at 87% capacity. And the team continues to work on communicating out about available scholarships to those who may need them. On the volunteer front, we've seen over 2,500 volunteers between Silicon Valley Strong and our vaccination efforts. And this past month, on May 19th, the Emergency Rental Assistance Program launched. And today we have over 1,000 applications already. We continue to support our unhoused residents across 5 new sites, the Monterey and Burnell, Rue Ferrari, Evans Lane, South Hall, and the Camden Community Center. The interest of time, this is just a brief snapshot of the efforts from this past month, but I do want to say that I'm grateful for all of the people and the teams in the Emergency Operations Center for their unrelenting work this past month and throughout the pandemic. Next slide. As I mentioned at the beginning, for ages 12 and above, the county, at a county level, 76% of county residents have received their first dose of the vaccination. For San Jose, we're at 79% for 12 and over have received their first dose. So we're slightly ahead of the county average and are making progress, but not for some of us. With unvaccinated disproportionately in the Hispanic, Latino, low income, young, and among San Jose's residents are particularly concentrated in the east side and near downtown. This is why we continue to push and support the county to vaccinate our entire community. The county has begun shifting strategies and tactics, and we have worked with them to support these efforts, including being much more targeted in our outreach, shifting vaccination events to evenings and weekends, trying new methods of communication to communicate with our unvaccinated residents, as well as helping support staffing resources for San Jose Vaccination Site. To go into more specifics, I'll now hand it over to Ann Tran, who leads our vaccination task force, and Carlos Velazquez from our emergency public information team. Ann?
Thank you, Lee. Good afternoon, Mayor, council members, and members of the public. I am Ann, and I'm happy to give you a vaccination update. Next slide. So we've been in vaccination support for over 177 days, excluding weekends. And the fire department has dedicated 82 personnel to support with various vaccination operations. So very first in January, they were supporting with the county with the first responders clinic, where we helped to vaccinate healthcare workers and frontline employees. And then as more supply came into our system, the fire department shifted operations to support with in-home vaccinations as well as community and mobile vaccinations. And very early on, we knew that the best way to get vaccinations into communities is to build on our partnerships and rely on those trusted partnerships to help us engage with our residents. So to date, we've partnered with 40 plus community partners, and those include healthcare providers. And together we were able to deliver vaccinations, hot meals, rental assistance, wraparound support such as shelter referrals, as well as stimulus check support in early April to May. And as our vaccination operations scaled to go beyond information sharing and community engagement, we added more team members to take on support items such as canvassing, phone banking, training volunteers, data collection, training and onboarding new staff and volunteers, and then tracking our finances and running large recruitments. So the culmination of having the fire department's injector capacity, as well as the community partnerships that we've built and more team members, means that we can bring more vaccination events into communities that need it the most. So to date, we've put on 14 vaccination events and vaccinated more than 23,000 residents, including some employees, through our partnerships and collaborations. And our vaccination support continues every single day, even on days in which we don't have a vaccination event going on. And that's because the 167 vaccine champions that we've onboarded and recruited for the county are currently supporting the county with countywide vaccination operations. And it's pretty heartwarming to put on events with the county and see that our vaccine champions are supporting us with our events like Children of the Rainbow and that last weekend with the Mayfair Community Center. Next slide. We want to continue ensuring that vaccinations reach more people. And there are two significant changes since my last update. The first is the expansion of the county's in-home vaccination program. Under the expanded eligibility criteria, the county broadened its in-home eligibility criteria and also allowed the fire departments to take on more vaccines per trip. What that means is that in addition to being able to vaccinate the participant that enrolled, the fire department can also vaccinate entire households who want that opportunity. And then we've also found opportunities to connect our residents to other resources such as library access, especially for homebound residents who might not be able to get to the library so easily. So those are some of the partnerships that we've been able to build through leveraging the in-home vaccination program. A little bit of numbers so far. The total number of interested people that called in or emailed or requested in-home vaccination support countywide is about 1,304. And the total number of people who were scheduled in which the county either called back or was able to schedule through their phone bank is 750. And of the 750, 365 of them are San Jose residents. And to date, our fire department, was able to vaccinate 320 of those residents that requested in-home support. And the other significant change is the expansion of buyer vaccine eligibility for 12 to 15-year-olds. And the county is making it as easy as possible for youth to get vaccinated. So the youth can either be accompanied by a parent or guardian, or have signed and written consent, or have the parent or guardian be available by phone to give consent. Moving on, we have a little bit of ways to go to get to 85% of our population vaccinated, and that is our goal by August 1st. The city of San Jose is currently at 79%, like Lee said, and the total population age 12 and older is pretty much a little bit less now that we have around 57,000 vaccinations left to go. According to covidactnow.org, which is supported by Harvard, Stanford, and Georgetown University, the city of San Jose is currently #1, leading in COVID-19 vaccinations, beating out San Francisco and Boston. And that speaks to the tireless efforts and the advocacy work that we've done as a city and alongside our partners to get more vaccines into our county when there was limited vaccines. And it also speaks to the impacts of our community engagement, education, and communications efforts. It's really a whole community effort to get us here. And as we look forward to reaching our goal of 85% of residents 12 and older, we have some work left to do. And it really involves being more creative in our messaging, more creative in our incentives, and making events more fun and ensuring that our communities are continually engaged and informed. And the work continues to drive up numbers in under-vaccinated census tracts in our city and our council districts, as well as engaging Spanish-speaking communities because they still need to drive up vaccination numbers in these highly vulnerable areas. Next slide. So going back to our roadmap, we want to continue focusing our efforts on supporting vaccination operations. And that includes building more capacity for community vaccination events, especially weekends and evening events to accommodate for working hours, continue our outreach efforts, and then provide injector support where there is need. And adding more capacity has little impact if the information and messaging isn't making it to the communities and residents that need it the most and in the right way. So the large part of our work looking ahead is to continue to engage, communicate, and educate our residents. And with that, I want to hand it over to Carlos, who will be taking us through a communication update on all of the work that's being carried out to support vaccinations. Carlos?
Yes, thank you, Anne. Saludos, Mayor and Council. My name is Carlos Velazquez, and I'm a Deputy Director for the Emergency Public Information Team in the EOC, and also part of the communications team with Environmental Services. I'm happy to share how we, the Emergency PIO team, are supporting the task force and county's work of getting our most vulnerable residents vaccinated while adjusting to changing audiences and strategies. One of these strategies has been using text alerts, which has proven to be effective in getting more of our residents to visit our important vaccine resource page and has supported our vaccine events. In May, we worked with the city's emergency management team to deliver 2 text messages through the wireless emergency alerts, Nixle and Alert SCC systems, which are used to notify residents about critical situations through alerts on cell phones, mobile devices, and even email. The city sent 2 text messages each in English and Spanish on May 20th and May 27th. The one on May 20th was sent to those in our priority zip codes and census tracts with the lowest vaccination rates in the city, encouraging them to get vaccinated and including a link to our vaccine resources page. The one on May 27th was sent to much less people, only to residents in the census tracts near the Mayfair area to promote a May 30th vaccination event at the Mayfair Community Center. That one also linked to our vaccine resources page with the event info on front and center on the top of the page. And as you can see on the graph, our regular web page traffic to our vaccine resources page saw a huge spike with up to 24,000 visits to the English and 4,000 visits to the Spanish page, vaccine resource pages on May 20th. We also saw a big spike on May 27th as well. This increase in traffic lingered for a few days after that, as you can see on the graph, showing that these texts help drive traffic for longer than just one day. And a reminder about our vaccine resource page, it has all the info in Spanish and English on current and upcoming vaccination sites in San Jose, important updates and resources. So this is just one of the campaigns that we've helped lead and that has supported the community canvassing, phone calls, and engagement that Anne and the Vaccine Task Force have conducted. There were more than 200 vaccinations at that May 30th event, more than what was projected. So I'm happy that we supported the event's success through this text messaging campaign. Next slide. Another tactic we've used to get our most vulnerable vaccinated has been our Zomad micro messenger campaign, which we've run the last month thanks to a partnership with the Knight Foundation. Recent county data showed us that younger adults have one of the highest rates of infection and lowest vaccination rates by age groups. So with this new data, it required a shift in tactics for our team. So we worked with the vendor Zomad to amplify crucial vaccine site and safety information through local online messengers, which you may know as social media influencers. Our 34 messengers, chosen with city staff input, mirror the ethnicity and ages of this new priority group. These messengers are San Jose artists, gamers, foodies, fashionistas, authors, and more, and have shared the vaccine message using their own unique voice. And since we started the campaign in early May, these influencers have been 130 times, with influencers also continuing to post daily updates on available vaccination sites. Their posts have already surpassed our goals. We have 1.4 million impressions and 21,000 engagements from those posts. And I just want to highlight that all those impressions, engagements are likely from people who don't follow the city of San Jose on social media and are now viewing, commenting, liking, or sharing the post with crucial vaccination information. I had the pleasure of reading all the great comments left by our audiences, and it just speaks to how successful this campaign has been. Some of the comments include, "Thanks for sharing. I was worried as well, but this post definitely eased a good bit of my concerns. Gracias. Excelente apoyo para la comunidad. Yes, gotta get mines this week too." And even the influencers themselves have left some great comments. One of them mentioned to us that it's been such a rewarding experience to be able to share accurate information with my community. The campaign has also given me the opportunity to talk a lot more freely about the vaccine with friends who have been on the fence about it. And I'm glad I've been able to be a resource for them. So it's just an awesome campaign that we've been able to do. In addition to Zomad, we continue to share multilingual original content and information on our social media pages from the county and other partners about clinic sites, safety, and updates. Our social media team has been creating very popular daily vaccine clinic posts in 4 languages that are being shared broadly. So for Father's Day and graduation, we created posts reminding people to get vaccinated now so they could be ready for those celebrations. And people are sharing our posts. Our Facebook posts in the last month were seen 9,500 times, which is 3 times more than compared to the city's non-vaccination, non-VTA posts. On Twitter, we doubled our engagement rate. Engagement rate is the percentage of people who engage with a post after seeing it. So I will say that the engagement rate is also slightly higher than industry average. We've also been sharing the information through Nextdoor, where we share vaccine events to neighbors and neighborhoods within a 2-mile radius of the event. And these posts have also reached 109,000 San Jose residents to date. Next slide. So as we've said before in past presentations, to reach a diverse community, we need diverse tactics. And in May, we launched several campaigns on television, radio, print, and digital channels that add to the social media and text messaging campaigns that we run, all focused on our priority audiences: Spanish speakers, Vietnamese, Filipino, Chinese, and Black African ancestry residents. We made sure that our investment in these tactics would give us the visibility that we wanted. We have TV commercials running during Univision's popular Gordo y la Flaca show. They, along with our Vietnamese commercials, are also running during the local news broadcast. The Reina Santillan of the Radio Caliente 1370 AM is the voice behind our ads with them. Radio spots are also running during the daytime period, which is helping spread our message to our priority residents who have the radio running as they work in kitchens and tiendas and talleres, or stores and auto repair shops. Newspaper ads are published on the popular weekend editions, and the digital ads that we have are displayed only to residents in our priority zip codes in District 3, 4, 5, 7, and 8. And what's the message? That the vaccines are safe, free, no insurance or proof of immigration status is needed, and that you can get vaccinated with or without an appointment. And we've also been quick to pivot with new information. The county recently disaggregated the Asian vaccine data for the region, which alerted to us that the Chinese, South Asian, and Filipino residents were at much lower vaccination rates than anticipated. So our team quickly pivoted, and we've been able to add media and build partnerships to reach those groups, in addition to the Spanish-speaking Vietnamese and other priority audiences that we reach out to. This week, we've also started rolling out social media ads on Facebook and Instagram, and next week we'll be working to launch them on Spotify and YouTube, all with the goal of reaching our younger residents, which, as I mentioned before, is a priority group for us. So these campaigns are going to be a perfect complement to the Zomad influencer campaigns that we've been running. And of course, none of these ads are running in isolation. We continue to meet with our partners at the county EPIO team, the Emergency Public Information Office, to manage, to make sure that our ads complement each other. So we meet with them regularly. And finally, direct outreach continues to be a key tactic for our EPIO team. We continue to use our stakeholder partners and distribution channels to deliver information, including more than 20,000 preparedness kits. These kits include a reusable bag, a face mask, hand sanitizer, and vaccination information in 4 languages. Our team has been distributing these at mercados, farmacias, and our colleagues at the San Jose Public Library. These tiendas or stores are all located in our priority zip codes, and they include Mi Rancho Supermarket on Story Road, Farmacia Doña Remedios on Willow Street, Lucky 7 Supermarket, and Lee's Supermarket and the El Viso Library, among much others. We also distributed a vaccination postcard to close to 100,000 residents who live in our priority zip codes, encouraging them to get vaccinated. So thank you, council members, for your ongoing assistance. We do have one request. I know that in April, we worked with your offices to provide you with preparedness bag kits for you to distribute. We still have some more of those kits left. And so if you wish to distribute more, I'd be happy to work with your offices. So thank you so much. I believe I'm gonna hand it off to Sarah for the next segment.
Gracias, Carlos. Good afternoon, Mayor, council members, and members of the public. My name is Sarah Sarate, Director of the City Manager's Office of Administration, Policy, and Intergovernmental Relations. I'll be walking you through the most up-to-date public health guidance related to COVID-19, which impacts how individuals and groups can and should engage in various activities. It also impacts the workplace environment and how we serve the public, which you'll hear more about later in 3.1. But before I get started, I have to preface the next few slides with a warning that much of this is as clear as mud. And the reason for the muddiness is the lack of clarity with public health guidance coming out of 3 layers of government, all of which impact our local landscape and whose rules and regulations can be inconsistent with one another and are dynamic. Public health guidance has been rapidly changing since last month, and much of that is driven by the great news that COVID-19 vaccines are effective at preventing COVID-19 disease, and especially severe illness and death. And they also reduce the risk of people spreading COVID-19. In general, the Centers for Disease Control and Prevention guidance, as their name suggests, provides the overarching guidance from which lower levels of government establish their regulatory framework, including states and local public health departments. However, while the CDC establishes the broad understanding and recommended response towards public health issues, as this depiction notes in the second bullet, more restrictive laws, rules, and regulations may be applied by federal, state, local, tribal, and territorial entities. Last month, the CDC updated its mask-wearing guidance, allowing those who are fully vaccinated to resume most activities with no additional prevention measures required, such as wearing a mask or socially distancing. Some exceptions exist, for example, for those with weakened immune systems, or if traveling on public transportation, or visiting correctional facilities or homeless shelters. This point is illustrated on the right-hand side of their Choosing Safer Activities visualization. If you're fully vaccinated, you can have a high degree of confidence that you will be safe engaging in all of these activities without taking any prevention measures. This is very different from the left-hand side of the visualization, where unvaccinated people are recommended to take prevention measures under most circumstances. Importantly, you'll note that this visualization does not identify a recommendation related to the workplace. In its guidance for those fully vaccinated, the CDC states one still needs to follow guidance at the workplace and local businesses. And again, this guidance allows for more strict rules and regulations at the state and local level. Which brings us to the state of California. Here, we've been operating under the Blueprint for a Safer Economy, which itself allows for more restrictive rules at the local county level. In California, rules will be changing to better align with CDC guidance effective June 15th. So beginning next Tuesday, the state is lifting capacity and distancing restrictions for most businesses and activities. While the matrix is seemingly straightforward, however, things get very complicated in the details. For example, you'll note that under masking, it refers you to current guidance for face coverings by the Department of Public Health. That guidance was last updated on May 3rd and does not include any changes effective June 15th. So we'll have to continue watching for updates for the general public. But the face covering guidance does state that in the workplace, employers are subject to the Cal-OSHA COVID-19 emergency temporary standards. And these took a very different direction last Thursday. On Thursday, June 3rd, 2021, the Occupational Safety and Health Standards Board convened to vote on proposed changes to the COVID-19 Prevention Emergency Temporary Standards. Cal-OSHA dictates regulatory compliance in the workplace. The revisions that were passed include updates to masking, physical distancing, and other prevention measures for both vaccinated and unvaccinated workers. Once approved administratively by the Office of Administrative Law, these standards will be effective on June 15th as well. So what are those rules? Indoors, if everyone in the room is fully vaccinated and no one has COVID-19 symptoms, no masks or face coverings are needed. But if just one person in the room is unvaccinated, everyone is required to wear a mask or face covering. Outdoors, if you're fully vaccinated, no face coverings are needed. But workers who are not fully vaccinated must continue wearing a mask or face covering if they're less than 6 feet away from another person. Even more complicating, the rules create a gray period between June 15th and July 31st, where, in addition to the masking mandate, additional social distancing requirements may remain in place if employers are not providing respirators such as N95 masks to unvaccinated employees for voluntary use. After July 31st, no physical distancing is required, but employers must provide all vaccinated employees with N95 masks for voluntary use. The implications of these rules are still unclear, and they're being reviewed by our teams to fully understand the impacts. But it isn't an endpoint either. Immediately after adopting these new revisions, the board convened a subcommittee to work with Cal OSHA to make further refinements in the coming weeks that will account for changes in circumstances, especially related to vaccine availability and low case rates across the state. So we can expect this to get even muddier. Here in Santa Clara County, as you heard earlier from Lee, we're still operating under the state's yellow tier and under a May 18th county order, which maintains mask requirement guidelines as determined by the state's Department of Public Health and mandates that employers ascertain the vaccination status of their employees, contractors, and volunteers who are currently or will be working in any of their facilities. It's still unknown when the county public health order will be rescinded. And with this public health context, I'll turn it over to Kelly Parmley, who'll be walking you through city services and resuming on-site work.
Well, thank you for that handoff, Sarah. Clear as mud or ambiguity, I think, well, certainly not something we want to deal with at the moment. It's something that I know we've all been working with throughout the entire pandemic from the moment we did shelter in place. And so I just want to make sure I'm expressing my gratitude to the Safe Workplace team, the safety team, the Office of Employee Relations, and our EOC leadership, because our ability is outstanding to be able to decipher, understand, and give direction with the number one priority being the safety of our employees and the public. So I'm confident, even though at 1:25 we were still convening to try to digest this and understand it, that we will find our way through it. And so I just, council, mayor, members of the public, I forgot to tell you I'm Kelly Parmley, the Assistant Director for HR. And here just to be a very quick update on where we stand with city services and resumption of on-site work. If you go to the next page here, before I speak just very generally to this, I do want to offer up some late breaking important news for us and something we should be really proud of as a city. Thanks to our folks in employee relations, a little bit of help from Public Works, IT, and our safety team, we've been collecting information that resides only with employee relations on the vaccination status of our employees. And at this point, we've heard from more than 80% of those employees and are pleased to report that almost 85% are either vaccinated or in the process of vaccination. And for us, that's a huge success and also good news for us as we proceed. How we reconcile that with all of the requirements from various agencies to be told in terms of what that looks like, but I think that's really heartening news for all of us. It's better than we are doing countywide for sure, and certainly better than some other agencies that we may compare ourselves to. So I want to offer that up as context. As we talk about this slide just very generally, when I spoke to you last in April, we gave you the kind of status of city services again, and want to offer up again with some real kudos to our departments who are taxed, but also are really folks who have been great partners in helping us understand where they stand with respect to opening city services, knowing that we want to make sure that we're putting everything forward that we can with respect to open and expansion of severely impacted services and the communities that they also then impact. And so we've been actively working with the library, PRNS, DOT, PBCE, Finance, Public Works, ESD are the ones that we've quickly been talking with, and they are all in good hands in terms of trying to move forward. We've got to understand the implications of this before we fully expand things after June 15th. But I just want to tell you that they've got great planning in place. And once we get over the safety hurdle, any other implications for expansion or reopening of services have to do with whether or not we have the right staffing in place, perhaps some shared space and shared services or something to that effect, where we have to do a little bit more coordination about how to expand or reopen. But that's progressing nicely, and I think we only have a couple of meetings left, but folks are actively in process there. On the next slide, just a couple of reminders, I think, for all of us, or at least I try to remind myself as we talk about the resumption of on-site work, and a few things in terms of big picture. 60% of our full-time workforce has been working in the field or in a city facility for most of the pandemic. So a lot of what we're talking about is how do we return folks both from the EOC to their jobs, but also sustain really, really important EOC efforts. So those conversations are actively happening right now. And then how do we think about the resumption of folks who are working remote to on-site? I will also note there that Walter and I had a very brief conversation this morning, Walter Lynn, to remind me that we have 400 structures in the city. City Hall is certainly an important and complicated one, but just a reminder that they're dealing with a broad array of city structures. Again, that's a core of 120 facilities, but it's not just City Hall that we're talking about. And they're doing a commendable job to try to balance all of those issues in terms of expansion and reopening. As you heard from Sarah on the second bullet, we're having to figure out safety and how we deal with employee vaccination information with all the different layers of government. Confident after our 125 conversation that we will find a way through in terms of soft opening of City Hall and of both employees and services. And then I would just say on the last bullet that, we're also actively talking about how do we leverage what we learned and continue to be able to offer in terms of a workplace that flexibility around working remote. It's not an easy balance to strike, and one that we need to experiment with a little bit before we arrive at a long-term understanding of what works best. Also, quite frankly, from an attraction and retention perspective of our workforce. So in this next slide, and I think it's my last one, just a reminder that we have put out 5 guiding principles. Again, this is just speaking to City Hall. We've talked about a reopening in terms of soft launch for bringing employees back to experiment with how we do that effectively in the City Hall space in early July. A lot of that experimentation is needed to understand how to reopen the first floor. First floor folks have all convened to talk about how they would do that by early August in terms of letting the public in for the most impacted services where we need to serve folks in person. And then in just a second, you're going to hear from Tony Tabor about some things that are happening with respect to hybrid environment for City Hall. So that's really all I have to offer at the moment. I'm sure we will entertain lots more information via questions. And I just really want to extend gratitude to Tony for taking on and joining us for 3.1 to talk about the next piece. So with that, I'll turn it over to Tony.
Thank you, Kelly. Good afternoon, I'm Tony Tabor, City Clerk. I want to say thank you to the following people who are part of this cross-departmental hybrid meeting team. I've been working with Walter Lynn, Kevin Lee, Eli Ferrer, and Jennifer Garcia from Public Works, Rob Lloyd from IT, Craig Jetson from the City Manager's Office, Neelam Naidu from the Attorney's Office, and Hal Spangenberg from PBCE. So this is a big cross-departmental issue, and I'm here to give the preliminary report on the future of hybrid meetings. Next slide. I'm sure we're all but eager to get back to in-person meetings again, and the current plan, should the county and state continue to improve COVID rates, is to return to in-person meetings of the City Council and City Council Committee meetings in August 2021. These meetings will continue to have the virtual component, allowing council members, staff, and the public to participate off-site. While we are planning to return to the City Council chambers, Public Works staff will be testing both council chambers and committee rooms to get the best solution, allowing the smoothest transition back to in-person meetings. In the beginning, I would recommend keeping boards and commissions fully virtual while Executive Order N2920 is in place, which I'll talk about in a couple of slides. Next slide. The inclusion of hybrid meetings promotes more flexibility for members of the public to attend in person or remotely. This will allow families to participate without adversely impacting school nights and dinner times. It gives staff and the legislative bodies some flexibility to attend in person or virtually. A lot of people can't take the time off work or from their home life to come to council and sit for hours waiting for the item they wish to speak on. With hybrid meetings, they can listen on their phone while working until it gets time for the item they're waiting for, or they can have their TV tuned to channel 26 while cooking dinner. In my house, it's tuned to YouTube on our big screen TV while the kids go out and do their stuff. So it's a background noise for us every Tuesday. And I'm imagining that that's how it is for some family. Next slide. However, there are some considerations we make as we move toward these hybrid meetings. Currently, the city is under Executive Order N2920, which has modified the Brown Act to allow members of legislative body to participate remotely. By legislative body, we mean city council, council committee, and boards and commissions. When this executive order is rescinded or modified, the location of the members of the city council or board and commission will need to be included on the agenda, and the public must be allowed to attend and participate from that location. This means if a commission member wants to participate from home, their home address will be on the agenda, and any member of the public can come to that home and must be allowed to view and speak from that location. So as long as N2920 is in place, we can hold fully virtual or hybrid meetings without this agenda requirement. Also, roll call voting must take place whenever one or more members of the legislative body is not in person. I know we all love to hear me call the roll, but sometimes it can slow down meetings. So that is a consideration when we're having people work virtually. Existing staff resources for city council meetings is not currently sufficient with the expansion to hybrid mode. Even with fully in-person meetings, the city has used IATSE personnel to fill the gaps to facilitate meetings. Ideally, permanent staff to assist in setting up and administering meetings would help us the most. We believe 3 to 4 additional AV technicians will be required to make hybrid meetings work effectively moving forward, but an initial 1 to 2 positions with more staff requested in the future as we move forward towards fully hybrid meetings for all legislative bodies. The city clerk's office would need an additional person to help manage virtual meetings. And if we move meetings to community centers, PBCE would also need additional staff to help manage those meetings in their community rooms. Additionally, significant investment needs to be made in the current software and hardware in the city council chambers and committee rooms. The current system is about 70% reliable when doing hybrid meetings. Due to the timing of an RFP process, the current supply chain issues that are plaguing the tech industry, as well as increased demand from all municipalities, plus the time it takes to implement, it can take about a year or so to upgrade the chambers and committee rooms to have a fully reliable solution. One of the suggestions has been to potentially modify certain commission and committee requirements to have meetings held in person in different parts of the city. At this point, the community centers are not prepared to reliably host hybrid meetings of a legislative body. But with sufficient investment in staffing, network, and technology, upgrades can be rolled out district by district. However, the Redistricting Commission and Charter Review Commission will be testing the community centers this late summer and fall, so they can serve as a pilot for the hybrid meetings of the community centers. We're working hard to provide a smooth transition back to in-person meetings and hope to preserve the virtual component we have all come to trust and rely on during COVID. And getting feedback from this meeting, we can bring this item back for direction later in June to adopt a transition plan prior to the recess. And that's all I have. And now it's back to Lee.
Thank you, Tony. I want to thank Ann, Carlos, Sarah, and Kelly and Tony for joining Kip and I for 3.1 today, and to congratulate Carlos on his first council presentation and say good job. With that, staff is available for questions, Mayor.